Hi guys, welcome back to my channel. It's Dr. Hardy here, your pediatric obesity expert. So let's just continue this discussion about, when to screen your child, and say your child did have the screening test already and now you have lab results and your doctor's talking to you about lab results. You have these lab results in your hand and you're still trying to grasp the meaning of it. Well, one mom sent me her child's labs and we're going to go over it now. So I have these labs pulled up next to me. It's scanned right here. If I'm looking to the side, I can't memorize your lab work. So it's a girl. She's 12 years old. She's African American, and her doctor is saying something about fatty liver, that the liver enzymes are high. So your child's liver enzymes, called ALT, is one of the liver enzymes, and it is 65. Yes, that is elevated. For a girl, any ALT above 44 is considered elevated. For a boy, any ALT above 52 is elevated. So your child definitely has elevated liver enzymes. I see this often. Almost every child that comes into the clinic has an elevated ALT, which we're talking about here, and something called AST, and those are liver enzymes. But yes, it's usually kids who have a BMI greater than the 85th percentile, which your child has, which was the reason that prompted lab results. I agree with your doctor. This is elevated, and it could be because of the weight, and this could be fatty liver. So fatty liver is basically what it sounds like. You have fat deposits in your liver. It causes inflammation in the liver. It's not supposed to be there, so those cells start getting inflamed, and that inflammation creates something called fibrosis or scarring. And so the healthy tissue of your liver starts getting replaced by scar tissue, and eventually it won't be able to do the work that it's supposed to do, and you can go into permanent liver problems, failure, issues, serious stuff. So before we just, panic, don't panic. Typically, your doctor will repeat these labs every 3 to 6 months to see which direction they're going. They'll tell you to start eating better, get rid of processed foods, sugary drinks, eat healthier, exercise, and continue to repeat the labs to see the trend of the labs. Are they steadily going up, or are they starting to come down? This may not even be fatty liver. There are a whole host of issues and diseases out there that can cause an elevated AST and ALT. So that's the reason why your doctor or provider is not going to jump the bandwagon here and go running after fatty liver. So what else could it be? One, it could be something called Wilson's disease. Two, it can be just poorly controlled type 2 diabetes that has never even been diagnosed yet. Three, it could just be, some familial hypercholesterolemia thing, which just basically means this high cholesterol problem that runs in the family, and it's affecting the liver enzymes as well. Four, it can be antipsychotic medications. Totally can. And I see a lot of teenagers on antipsychotics and weight gain and abnormal liver enzymes. It could even be alcohol, and people don't want to think about their kids drinking alcohol, but kids are getting younger and younger and doing things that we wouldn't expect them to do. Trust me, as a pediatrician, I have seen it all. And 9-year-olds drinking, yes. So we can't dismiss street drugs in this age group. I mean, street drugs in the teenage age group is not so, hard to digest, but younger than teens, really hard for parents to digest. So what do we do about it? Well, back in the day, we used to send these kids for ultrasounds of the liver to rule out fatty liver, but it's no longer recommended. So it's just, I don't want to get fancy with words like specificity and sensitivity on you guys, but basically the test is not really accurate enough where it's going to give definitive results. That's the best way I can put it in layman's terms. So now ultrasounds of the liver are no longer recommended, and biopsy is the gold standard. So before we go biopsying a bunch of livers, your doctor is going to do this, serial blood work, see which way it's going. And if it gets to the point where that ALT is like greater than 80, and this has been going on for more than 3 months, persistently, you're probably going to get referred to a gastroenterologist who may do the biopsy. So if you're at the point where you're going to the gastroenterologist for a biopsy, they will continue to monitor you and do serial biopsies. I don't know how often they will do it. I'm sure each gastroenterologist does their workup a little bit differently, but they will repeat biopsies to see which way it's going. They may even start you on some vitamin D, and they will talk to you about losing some weight, you meaning the child. And they would even, in really severe scenarios, maybe, if it looks like the child already has cirrhosis of the liver, will talk about weight loss surgeries if they meet the criteria for weight loss surgeries. I think most places, wouldn't do anyone less than 16 years old or something like that. But bariatric surgery is a part of the management if it's really bad. And I do recommend it as well if you're on the brink of, liver failure. You don't want liver failure. Mom, thank you so much for submitting your child's labs. I certainly agree with the interpretation of these labs. I agree that your child should continue to have serial lab work to see which way these labs are going. And if they send you to a gastroenterologist, I do agree that your child should go and get that biopsy. So thank you so much. And anyone else, feel free to send me some labs and I will look over it. You can cross out any identifying factors like the name of your child, date of birth. I don't want any of that information. You can send me a message, just age of the child, race. So African American, 10-year-old female, her total cholesterol is 202, her triglyceride is 101, and we can discuss it, okay? Thanks for tuning in, guys. See you in the next video.